more sharp and pointy, so that we can give her a perfect feminine nose. As well, you can see that her nasolabial sulcus, it's quite deep. Mild jowl is present. We can see there is drooping or the totus of submental area or chin. So we are going to perform a bilateral facelift for this patient, through which her entire skin is gonna get stretched back and she is going to have a more youthful appearance than what it is right now. Along with that, we are going to do a genioplasty for this patient, in which we are going to bring her chin little forward. We are going to do advancement both vertical and horizontal, so that the face is in a good proportion and she likes the aesthetic afterwards. Okay, thank you.
This is before we did a tertiary or a third time redo rhinoplasty. And this is her immediately on the table. The first, actually a quaternary, the first 3 times she got it done. Another place she had issues with the shape of the nose. It was way too masculine. We made it feminine. Get a better tip, curved dorsal aesthetic lines, as you can see. Now this was straight. We've also reduced the nasolabial grooving. This is the before, slight asymmetry also that you can see, scar from the earlier surgery. And this is the correction.
So today is her 11th post-operative day. We had done multiple procedures on her. We have done an entire face maker for this patient. We have done rhinoplasty, genioplasty and bilateral facelift for her. So we are going to remove the splint today, and I will explain it to you one by one what all procedures we did and what all changes we can see in this patient. थोड़ा सा pull होएगा, okay? So as you can see, this is a pre-operative photograph. In the pre-op photograph, you can see that she has a droopy tip, whereas in post-op, after doing dorsal augmentation and tip to give her a pointy tip, you can see that her tip is quite pointy. So she had a depressed dorsum and radix. We have increased height of both the radix and dorsum. So we have used a rib cartilage for her. We have augmented both dorsum and radix and given her a nice dorsal height, a nice pointy tip, good radix height. Can you look up? And nice nasal base asymmetry. This is what we have done in her nose. You can compare it from the pre-op photograph to the post-op photograph. Now we'll come to the chin part. As you can see that she had a short and retruded chin, which was not giving her a very good profile. In order to improve that, we have done an advancement genioplasty, in which we have moved this chin segment around 6 to 7 mm forward and given her a nice pointy chin, which will improve the overall facial shape. Also, it will help us reduce the loose skin which we have under the neck. Third procedures which we did was bilateral rhytidectomy, which is also known as facelift. Can you turn that side? As you can see that the incisions are not visible because we have taken it in the preauricular or the area just behind our auricle, which is not clearly visible to naked eyes, and the incision extends in a hairline posteriorly and anteriorly. So you can see that her face was having loose skin and loose tissue. So we have done a superficial or deep plane rhytidectomy procedure for her, in which the whole face has been pulled little up, the jowls has been decreased, and she is definitely looking almost a decade or 2 decades younger than what she was before. She was already very beautiful before, but definitely the patient wanted certain changes in the surgery. So we have done 3 procedures for her: bilateral facelift, rhinoplasty and chin augmentation, or also known as genioplasty. Okay, so can you get a mirror? बहुत ही अच्छा रिजल्ट आया. Of deep nasolabial fold, after the facelift procedure, you can see that the depth of nasolabial fold has decreased drastically, which is giving her a much younger appearance. Okay, can you give me a mirror? इससे बड़ा नहीं है. ओके, होल्ड दिस. सो एक बार अपना नोज देखिए. स्टिल देयर इज अ लॉट ऑफ स्वेलिंग ओवर देयर. बहुत स्वेलिंग है अभी, जो थोड़े थोड़े मे बी 1 मंथ 2 मंथ्स 3 मंथ्स में कम होगा.